Oh, look, I think that the ACRM fellowship gives a person, a doctor that wants to join and actually be a GP, a really, really great opportunity to actually practice more towards what I think probably the older generation of Australia remember as the general practice doctor that they used to have. I can go back to my own experience where my GP, who birthed me, was my doctor for, I think, until I was in my early 20s. And by that point, I was actually in med school. He was actually a doctor that worked with the British Army during the Second World War and was on the actual front line in Burma. And so he was a great inspiration sort of during all those the initial struggles of med school, and you're learning things, and he can sort of say, well, this is where you're going, this is like what the outcome will be. And because back then they did everything, they did the anaesthetics, they did obstetrics, they did surgery, and this college is going back towards that kind of not so much commitment but philosophy, where the doctor within the community is been given the skill level and the assistance, whether it be locally or by distance, to actually do a lot more than what is sort of like normally done within the large metropolitan areas.
And how much has general practice changed over in the past 20, 40 years or so? So what do you think needs to change again, or what needs to unchange?
I think where the ACRM College philosophy is a really, really great starting point, and where they're going towards training people in the rural setting, getting people back to the rural setting. I think they're going to really go forward and do a lot more for communities, and I think you'll find that even some of the larger communities are going to really appreciate probably having ACRM trained doctors within their community that can actually do a lot more.